Hi, I'm Tracy Epperson. I am a fourth-year resident in psychiatry here at Unity. So because of my background, I am very aware of the need for that patient and provider trust and that rapport, and I am aware that that requires knowledge of the patient's culture. Maybe you don't have to be fluent in their language, but you have to understand that their language is an inseparable part of their treatment, of their mental health and health in general, really. And so I think that because of my background, I'm maybe more aware of that than if I would have just gone straight to medical school. So I think a really unique thing about me is that I'm 50 years old. So this is not my first career, or probably not even my second career. I actually was a sign language interpreter for about 2 decades before I decided to start medical school. So I was interpreting a lot in the mental health setting, and so I was seeing the deficits there for our deaf patients, that the providers that were working with them weren't knowledgeable about the differences in deaf culture and their language and the things that are really important to establish trust. And really, for good treatment, you have to understand the differences, the nuances involved. And so I decided that I was going to make a difference. And so currently I'm passionate about several things. My family, obviously, but I'm also really passionate about establishing some kind of central location that people, especially providers, can go and learn about mental health as it relates to the deaf community, maybe get resources to help them to better provide care for the deaf community. And I'd really like to do some kind of outreach for the deaf community to help them learn more about their own mental health, things that they don't really have access to maybe every day like we do, because of that barrier of communication. So if they go to, say, a psychiatrist or a therapist, then we have to bring in an interpreter who's a third person. And so there's a lot dependent on the interpreter, on the patient's comfortableness with disclosing everything with a third person there. So there are just a lot of variables involved that prevent them from having access to the information that I believe everyone needs to have access to.